The next question is coming from Charlie Angus. Please, Charlie.
Thank you very much for being here, and Mr. Khan, it's nice to see you here. We're both in our suits today. The last time we were in Attawapiskat, we were in our rubber boots. I only have 7 minutes, and I have so many questions. I wish we could do this all day, but I only have 7 minutes. So I don't want to sound rude, but I got a bunch of short questions and hopefully short answers. Can you confirm that the Conservative government set aside money to implement Jordan's Principle between 2008 and 2012?
There was actually the ACTA fund that was created at the time, yes.
Okay. So is that fund, I didn't see it in this budget, so is that fund there now to implement Jordan's Principle?
The fund has been eliminated in the context of the Deficit Reduction Action Plan.
Okay. So today is the deadline for implementing Jordan's Principle, so there's no fund to respond to the Human Rights Tribunal, but there was under the Conservatives?
I would say I cannot really answer your question the way you're presenting it. Today
Okay.
is the
So
date
today is the deadline
to answer.
Yeah.
We have taken some measures in order to be in a position to acknowledge the decision of the
acknowledge
tribunal.
the decision, okay.
Our staff have been directed to move away from the old definition because the tribunal has been really clear about what should be the approach going forward.
But there's no fund set aside to implement?
The envelope that was set aside up to 2012 is not there
It's not
anymore.
there, okay. So looking at the Human Rights Tribunal ruling, a lot of the evidence is child welfare, but a lot of it was your department. And so looking at the evidence that was put forward by your own officials, there's some pretty disturbing statements. Tab 78 on gaps in service delivery to First Nation children says that the denial of prescriptions that have been ordered by pediatricians is common. On what basis, like who would make a decision to deny a child prescription if a doctor's ordered it?
So I cannot really comment on the case specific that was behind this and the evidence that the person or the witness that have brought this to the attention of the tribunal. What I can probably ask is Scott to give us a sense of what is our rate of approval and the instances where
these aren't individual cases. This is systemic. That's what they're saying. These are systemic issues that children are routinely being denied prescriptions that have been ordered by pediatricians. Tab 302 that was supplied by Health Canada to the Human Rights Tribunal says that if a child with multiple disabilities requires a wheelchair, lift device, or tracking device, they're only allowed one of those items. And if they opt for a wheelchair, they don't get a motorized wheelchair. It has to be an adult pushchair. So is that like policy, or is that what the bureaucrat decides?
The level of coverage and the criteria for coverage depend on the nature of the handicaps faced by the child. So each case is assessed case by case. If the service or the supply, the medical equipment is required, it will be paid in full by the program.
Okay.
There was some issue raised in the tribunal, for example, related to medical beds.
Yep.
We have resolved that issue.
Okay. Because that was the one where the child was going to die, and Health Canada said absolutely not.
Yeah.
And the doctor paid out of his pocket. So I want to ask, because it's come up with the testimony from our hearings, some very disturbing hearings, and one of the allegations that's come forward is that Health Canada is telling doctors only to use one catheter bag a day, which means they have to reuse them, which the doctors, I'm not a doctor, I don't know much about this, says they cause recurrent infections, kidney disease. So is that a decision made by a doctor at your office, or is that just someone crunching pennies here?
I'm not aware of this, any directive about this. Scott, I don't know if under medical supply and equipment, if there is such a directive. I've never seen that, and I've been in this program for a number of years.
Okay, so, I mean, that's a pretty serious allegation. Dr. Curlew says that children are dying from childhood illnesses that are known elsewhere, such as rheumatic fever, because they're being prescribed Tylenol. So when a child dies at a nurse's station from a lack of medical supplies, are there investigations done to find out why that child died?
Yes, when there is incident, it's not only in case of deaths. When there is incident, there is a protocol to review the incident, to review the charts, and involve external parties if needed in this review. The objective is to understand the cause and if there is any responsibility of the health provider in this context, and also to improve the process.
Okay, because Dr. Curlew stated yesterday in the newspaper that he's concerned about his the Hippocratic Oath as a doctor under non-insured health benefits because he says, I know the system is actually harming people. So I would think you'd want to look into that. But I'm running out of time here. I wanted to know about the department states that Health Canada spent $300 million on mental wellness last year. This year's RPP state $270 million. So does that mean a $30 million drop in mental health programs, and what program would that come from?
No, there is no reduction of spending in mental health. This is probably related to programs that are being renewed and will appear when we get to supplementary estimate process.
Okay, so I'm told there's only 10 mental wellness teams for Indigenous mental health teams across the country. First Nations are saying they need 80. So can you confirm that there are 10 mental wellness teams?
Based on the mental wellness continuum framework, we have started to invest in a couple of years ago into building mental wellness team. This is a model that has proven to be effective.
Yeah.
At this time, there is 10 or 11, Tom? 10 that are being funded throughout the country. But
So-
this is in addition to the local mental health services.
Okay, so we've been told there's only $350,000 put into that First Nation mental wellness continuum framework. Is that true?
No, and we are spending, we have spent last year around $300 million in mental
No, I know,
health.
but within that framework, I've been told up to date there's only been $350,000 put into that. Is that?
I cannot comment. So part of the framework is also to manage the funding that is already in place in these programs to realign them under the framework. This was the intent of that framework, but also to inform future investment.
Okay. Okay, I guess finally then, going back to these issues that we're seeing from the doctors, so the testimony that was raised at our committee about children who are left at a nurse's station for 13 hours crying in pain because they don't have painkillers, or children starting to suffocate because they don't have Ventolin, that to me is pretty disturbing. It would sound to me like if that's a common practice, wouldn't that be kind of like institutional malpractice? How is that allowed to happen in a medical system in 2016?
We're
Situation that-
right out of time there, I'm afraid. If you can maybe get the answer into another question if it's appropriate. Thanks. The next question is coming from Remy Massé.